Hi, my name is Kim Passini, and I'm a physical therapist in Iowa City. I work at a clinic called Team Iowa Physical Therapy, and I've been working there for about 3 years. So, my job today is I'm going to talk to you about what it takes to become a physical therapist and what the actual job of being a physical looks like from a day-to-day perspective. So, I'm going to pull up a PowerPoint. And here we are. All right. So like I said, I work at a clinic called Team Iowa Physical Therapy. Here we go. So what is a physical therapist? So a lot of people sometimes might have their own experiences with going to physical therapy, whether they've had a surgery or whether they've sprained an ankle or broken a bone. So physical therapy kind of looks a little bit different depending on the setting. So I work in an outpatient setting, which basically means people who are not in a hospital setting being an inpatient setting. So with my job, I work primarily with musculoskeletal and neuromuscular conditions or injuries. So whether that's a traumatic injury, a gradual onset injury, a chronic issue, or some other underlying medical issue. I work with people of all different ages. So I've had patients as young as 5, 6, 7 years old, and I've had patients as old as in their 90s. So it's kind of all different walks of life. My clinic is considered a private practice, which means that we're not associated with a hospital system or any other large group. It is my boss who started it, and my boss is right in the middle, the blonde guy. Standing next to him is his wife, Annalise. So Joe and Annalise started this clinic 3 years ago in March. So since then, he hired on. There's now 4 other clinicians and 2 office staff. And we also have 2 technicians as well. So there I am on the far left. Standing next to me is Matt. And then we have Joe and Annalise. Next to Annalise is Will. He's our physical therapy assistant, which I'll talk a little bit about. And then Janie's one of our business managers. So how do you prepare to become a physical therapist? So it's going to require an undergraduate degree, so a bachelor's degree in any field. So that means that you can be a biology major, you could be a history major, you could be an engineer, really anything that interests you, you can major in. The one kind of caveat to that is that you're going to have a heavy focus on science prerequisites. So what I mean is taking a lot of biology, chemistry, physics, different anatomy classes. These are the classes that a graduate school program is going to require you take and do well in order to get into PT school. So like I said, they look at your GPA in your as a major as a whole, and then also in these specific prerequisites. And then they also look at your GRE. So that's a graduate test that focuses on a few different categories that they want you to do well in. They also are going to look at observation hours in a variety of settings. So that means in a hospital setting, outpatient setting, maybe pediatrics, maybe working with an athletic team. So you might be wondering, how do I get these different patient interactions? And you're going to want to reach out to different clinics and hospitals and ask if they're accepting students for observation. So it's going to depend a little bit on your age. Sometimes different settings won't accept high school students and they want someone who's in college, whereas other settings are going to be more open to letting high school students observe. Other great ways to start to get some of this patient interaction is to apply for a tech or an aide job. Or working as a CNA or working as an EMT, kind of anything that you can get some patient observation with. You're also going to want to have a wide variety of extracurricular activities, so particularly leadership and teamwork activities. Also volunteering, community outreach, service projects are another things that graduate programs look heavily into. So after you get your undergrad degree and you take the GRE and you do all your observations, hours, and all that good stuff, you apply and then you get accepted to a doctorate of physical therapy. So that means it's a 3-year graduate degree in addition to clinical education on top of your undergraduate degree. So you're looking at about 7 years after high school of schooling. after you finish all your clinicals and your schoolwork in graduate school, you're going to take a licensure exam or a boards test. You're going to pass it, and then you're going to start your job. So I kind of touched on this, but there's a lot of different types of PT. So if you've ever had an injury, you might think of that classic outpatient practice, similar to what I work in. But you're also going to have an inpatient setting. So that means you could work in the ICU, work with post-op patients, work in acute care. You also can work in a skilled nursing facility. You can be home health, work with pediatrics. There's different kinds of rehab facilities, like working with spinal cord injuries. And then there's even PTs in an emergency room setting. There's also women's health, vestibular, aquatic therapy, and working with athletes as well. So a whole wide variety. So day to day, there's going to be different things you love about your job and other things that are more challenging. Just like any other job, PT is no different. So things that I personally love about being a physical therapist is I get to work with people every day. And I'm helping those people reach their goals, which is a really satisfying feeling when you help someone get to a point after they've had a surgery or broke something and they're struggling. So it's really rewarding in that sense. It's also fast-paced, so you get to think on your feet. Every day is going to be a little bit different, and it's pretty active. So I love that. You kind of never know what to expect when you go to work, because working with people change, so you have to be able to adapt. Challenges of the job are kind of the nitty-gritty of it. So you have to do documentation, which is basically just paperwork. You have to deal with insurance companies. So that's insurance companies denying patient care, which kind of stinks. It's hard when you have patients who aren't compliant. So you ask them to do exercises and they don't, and then they don't get better, and you're trying your hardest and they're not kind of keeping up their end of the bargain. So that's hard. It's also physically challenging. So I will say, at the end of the workday, I am pretty tired. I'm on my feet all day. My feet get tired. My knees get sore. Working in an outpatient setting, I don't have as much lifting, but a hospital setting, a lot of times you will be helping transfer patients. And if you're short like me, I'm 5'4", that can be kind of hard work to lift someone who's bigger than you. So I thought I'd give you kind of an example of what we do. Since you're not able to come into the clinic, I thought I'd give you a look into a somewhat kind of typical patient that's not too super complicated. So here's our example for the day. She's a 75-year-old woman who comes to you with a painful knee. They're referred from their primary care doctor with a diagnosis of knee osteoarthritis. So she has pain when she kneels in her garden, pain bending down to pick up her grandchildren, and also pain with just walking throughout her house. Her pain is described as stiffness after sitting for a long time. And she tells you she doesn't do much for exercise, but she has enjoyed biking in the past. So when a patient comes to you, you're going to want to do an initial evaluation. So what you start with is an interview. So you're going to ask this patient a lot of questions. We call this a subjective interview. So that's what the patient is telling you. And you actually can get a lot of information from just simply what they tell you. So some more specific examples is you're going to want to know their past medical history. Have they had any surgeries? Do they have any other medical issues that might change your plan of care? You're going to want to know the aggravating and easing factors, which basically what makes it better and what makes it worse. You're going to want to know what they're limited with, so what activities are difficult for them. If they've ever had any prior treatment or if they're taking medications for these issues, how long they've had this pain, and then where they're having their pain as well. So those would be all things I would ask for. And after we finish the subjective interview, we're going to go into an objective interview, which basically that's looking at their range of motion, their strength, what I visually see. So these are kind of the main categories of PT we'll look at. So observational, look for swelling, bruising, how they move, how they're walking. Palpation basically means touch. So are they sore when I touch on their knee? Their range of motion, can they flex and bend and straighten through their joints? Their strength, and I'm going to kind of touch on these a little bit more, some videos coming up. Sensory essentially means are they numb or tingling anywhere? There's a category called special tests, which is just a fancy kind of category of different things you can look a little closer at. And then most importantly is PTs look at functional testing. So that means how they move with their day-to-day life. So squatting, sit to stands, moving around in bed, walking up the stairs, kind of all that stuff that PTs work to help improve. Oops, I skipped okay, so here's some videos. So looking at range of motion. So we use what is called a goniometer, which is a fancy name for a really large compass thing, like what you use in math class. So I'm gonna play this video for you.
Back, why don't you go up and bring your knee up, all right? Just like this, and I want you to slide your heel back as far as you can. All right, pause right there. I'm gonna take a measurement for you. Okay. All right, there we go. Oh, 121. Now I'm going to push you a little bit further, see if I can get you a little further, okay? A couple more degrees, 126. Nicely done.
So what that was looking at, knee flexion, so the bending of the knee, and Will, our physical therapist assistant, first had the patient do their active range of motion, so that's what the patient can do themselves, and then he added a little bit of overpressure, which is what we consider passive range of motion. So you're going to want to look at both active and passive, and then you're going to want to compare both sides so you get a symmetrical sense. So now we look at strength for knee flexion.
All right, Matt, I'm going to put you in a position, and then I'm going to force you down to test your strength. When I tell you to, I want you to push your foot into my hand just to see how strong you are, okay? So I want you to start here, all right? And then I'm gonna push you down. Don't let me push you down. Very nice. Okay, same thing, relax for a second. Bend it a little bit, bend. Now I'm gonna pull you up. Don't let me pull you up, okay? Oh, yeah. Very nice, nicely done.
So that was looking at knee flexion and extension strength. So it's called manual muscle testing, and it is scored on a scale of 1 to 5. So there's different criteria you have to hit to reach each point. So a 5 out of 5 on manual muscle testing would mean that the patient tolerates kind of max force from the physical therapist, or we say the physical therapist isn't able to break them, meaning they hold it in that position, and as Will is pushing into that knee, the patient is able to maintain the pressure out, so Will can't move their leg at all. So that's kind of what we look like from initial evaluation point, but then we want to get into the session because we want to help this patient. So our clinic works a lot with manual therapy, which is using your hands and tools to work on soft tissue and joint mobility. I'll show you some tools on the next slide. So basically we know that this can help decrease pain and improve mobility when we do soft tissue work and soft tissue massage. We also use neuromuscular re-education. This is a fancy word for some of the exercises we do that help to restore normal body movement using your nerves and muscles. So we know nerves send signals to your muscles to tell them how to move, when to move, how fast to move. Then we use another category of exercises called therapeutic activities, and this essentially means working on functional skills. So this is when we're teaching our patient how to do an exercise like a squat, which we'll talk about on the next slide. Then we have therapeutic exercises, which just kind of is the nitty-gritty of strengthening the muscles. And then a lot of times you'll see modalities used in PT too. That's like using heat, ice, things like that. So here are some tools that we use in the clinic. So we use our hands a lot. So that's one thing, if you want to be a PT or a PTA, you got to be okay with touching people. So we do different massage work and what we call joint mobilizations. We also use instrument-assisted soft tissue mobilization tools. So those are the blue and the metal tools on that top pictures. It's a great way to get a little bit deeper into the tissue, and then it also helps protect your hands. The Hypervolt is another massage tool that we use on the bottom left. In the middle, we have cupping. If you remember, maybe you guys are too young. The Olympics, I think 8 years ago, when Michael Phelps had all those big circular bruises on him, cupping became like really trendy then. But it's just basically another manual therapy technique. Same thing with rock floss or rock tape on the bottom right. That's another way to help kind of move fascia, stretch through the muscles, basically putting an input to the system so that your tissue can move a little bit better. So then we want to teach our patient how to exercise. So here's just a little example of what we might be showing a patient in the clinic. Oops. Maybe. There we go.
All right, Mac, I just want you to demonstrate how you would do a squat right now. All right, come back up. Show me one more time. All right, come back up. What I noticed here is your knees came in when you're squatting. All right, you were getting a little bit butt back, which is what I want. But when you go down again, I want you to focus on keeping your knees in line with your feet. So you're going to come down, that butt's going to shift back, and you're going to squeeze your glutes and then come back up. But try to watch where your knees are going, okay? There we go. Perfect, and then come back up, and then golden rules, don't let your knees cross your toes, okay? So don't let your knee hit my leg. Pretty good. You still touched it though, but that was better. Good.
So that's kind of a quick example. A lot of what we do is education for our patients. So we're teaching them how to move better and to move in new ways that are not painful to them. So that was kind of an example of Will providing some cues. So notice how he used his voice. He gave descriptions, but then he also used some hands-on cueing techniques to help that patient learn the movement. Unfortunately, most of our patients do not learn as fast as our tech Mac did in that. So that's kind of part of the fun challenge of the job, is you have to be creative in how you teach different people how to move. So in case if you ever do go into a PT clinic to observe, if this is a career that interests you, what do you expect? So right away, know that they're going to ask you to be HIPAA compliant, which basically means maintaining patient confidentiality. You're not allowed to talk about anything that you see to other people that identify a patient when you leave. Feel free to ask questions when appropriate. So you don't want to interrupt a PT during a session. But it will make the patient feel more comfortable too if they feel like you're engaged with the situation. It's always going to be a great chance to participate, try some exercises out, see how it feels to your body to move in that way. And then basically just use it as an opportunity to listen to how the clinician and the patient are interacting with each other. And I thought we'd kind of end with a little bit of some fun facts about physical therapy. So a lot of people don't know that I was actually a direct access state. And what that means is you don't need a doctor's referral to go to PT. So let's say this weekend when you're running around, you roll your ankle, you sprain your ankle. You actually don't need to go see your doctor first. You can call your PT up right away, and insurance companies will still cover that. You also can get certified in lots of different specialties. So I'm trained in dry needling. There's different certified strength and conditioning specialists. My boss is a manual therapist. Oops, where did my PowerPoint go? There we go. Sorry, guys. There's also different career paths. So I'm a physical therapist, but you can also be a physical therapy assistant, which is Will. He was the one in the videos. And that is going to be a 2-year degree, a 2-year associate's degree right now. So a lot less schooling. The difference is that PTAs, or those assistants, cannot do initial evaluations, and they have to work underneath a physical therapist. So the PT establishes a plan of care, and the PTA follows that plan of care. And then the other fun thing is we're doctors. We have our doctorate of physical therapy. So you won't hear most PTs want to be referred to as doctors. And in a sense, almost, I prefer not to be called that in the clinic. I prefer just to go by Kim. To kind of make it feel less of like a doctor's office and more of kind of a fun experience for our patients to come to, just because of that connotation of going to a doctor. But we are doctors, so it takes a lot of schooling. And when you finish that path, just own it, that you're a doctor. You worked hard to become here. So kind of to wrap things up, obviously this is a recording, so you're not going to ask questions right now, but I do have my email here. So if you have questions that come up, I want you to reach out to me via email. I'm happy to answer any questions that you have about PT or about my clinic at Team Iowa or what I do every day. I also listed our office phone number and our address. And if you guys are familiar with the Iowa City area, we are located at North Dodge Athletic Club. And as of May 26th, our new expansion, our new building area is almost done. So hopefully in a week or two, that is complete. So, well, I will wrap things up here. I'm going to stop sharing my screen. And like I said, if you have questions or want to know more about PT, please reach out to me. And otherwise, thank you for listening for these last 20 minutes.